Hi folks, my name is Mike Dobbs and I'm your host for another edition of Government Matters, right here on Focus Springfield. We're doing something a little bit different today because you know Government Matters tends to focus, no pun intended, on elected officials, department heads from the city of Springfield. But the truth is that the legislative delegation in Springfield is part of the Western Massachusetts delegation, and those people work together. And the reason they work so closely together, the state reps and the state senators, is simply because we can't get things done in the legislature without cooperation and collaboration. We don't have a big enough voting bloc in the Senate and in the House to do that. So today we're breaking our format a bit by having a gentleman on whose work certainly affects the city of Springfield. It affects his district, it affects all of the Commonwealth, and that's State Senator John Velis. And of course, John Velis is well known in Westfield and Holyoke. I think you still have part of Chicopee, am I correct on that? For his senatorial district. And the issues that he has come to the forefront with certainly affect all of us. And I thank you very much, John, for coming by today to talk to us.
I appreciate you inviting me. Thanks for having me.
So I just want to get my stupid reporter question out of the way, and that is, could you give us a little bit of an update on what's happening with the Holyoke Soldiers Home in terms of the design and construction and where it stands, because certainly you've been very, very involved with that issue.
No, absolutely. We fully anticipate that building is going to start this summer. First step being the domiciliary facility. So if you're driving up, you know, the hill right there, that facility right there on the right, known as the Dom. So we fully anticipate it to start this coming summer. Now, one of the challenges with some of these projects is that when they involve multiple sources of funding, in this instance, the state as well as the federal government, because the state VA construction program is a collaboration between the state and the federal government and all the states that have these veterans homes, Massachusetts, of course, being one of them. So going back 2 years now, 2021, Massachusetts passed a $600 million bond bill, with 400 of that, of course, going to Holyoke, and then the extra 200 being for facilities in the future, because we're very cognizant of the fact that both Holyoke and Chelsea are two existing homes, primarily cater to veterans in the surrounding communities, the immediately surrounding communities. So that's something that we want to plan for in the future. But that being said, that was 2 years ago, and we just got the vast majority of the funding from the feds 2 weeks ago. That was the last piece we were waiting for, so we're on track to begin this summer with that process.
So we're talking about the actual start of construction, like demolition and groundbreaking, that type of thing?
Correct.
Wow. Do you have an anticipated timeline for when this will be completed?
You know,
because I know it's a big project.
It is a big project, and it's important to keep in mind that it's a project that's going to happen keeping the residents where they are. So you're going to knock down part of it, keep the residents where they are, and then almost do a switch, you know, build up, move the residents over there. So I've long since given up projections on when government is going to get a project done, particularly right now with some of the skyrocketing prices as well as some of the supply side stuff that we've seen. But once they get going, to me, once it gets going, then it almost becomes like this self-fulfilling prophecy of moving it along. And that's always been my experience with government projects. I would be much more comfortable answering that question if I'm back on this show after that first grand opening, if you will, or that ribbon cutting, or the groundbreaking. So we anticipate that it's going to be a 2 to 3 year process, roughly. Hopefully on the sooner side. You know, I certainly in my capacity as the state senator for Holyoke, I'm going to be doing everything in my power to move it along to ensure that deadlines are met, but also understanding that we do have residents being there. So the continuity of a place for residents to be at and to call home during that is really, really important. And that is one of the reasons it's going to take a little bit longer, because again, they are going to stay there without a big disruption in their daily lives.
I know that after everything that happened during the pandemic at the Soldiers' Home, there was a lot of effort made to try to build in reforms to make sure that something like this would never happen again at any veterans facility.
Absolutely.
Are you satisfied with the reforms that have been put in place?
Yeah, I think it was. So like all lawmaking, right, the sausage making of how a bill becomes a law is it's not the cleanest. A lot of times it's messy. We passed a really good bill in the Senate. And full disclosure, I had a lot to do with the writing of that bill. Our friends in the House also passed a good bill. Conference committee is a give and take, where there's back and forth. The essential elements, what I would argue, that would go a long way to preventing something like this happening again, were preserved in that conference report. Very specifically, the chain of command issues, right? Chain of command at the most basic rudimentary level is that when something happens at the lowest of low levels, how long and how efficient is that process to getting it to the folks that would be able to make a decision? We have it in corporate America, we have it in the military, we really have it in all organizations and entities out there. That was absolutely broken in March of 2020. And one of the, I think the most compelling piece of evidence I would offer in that regard is that, and I remember this, that I was on the oversight committee that both the Senate President and the Speaker of the House asked. And I was speaking, interacting, questioning General Keefe, who is, of course, the Adjutant General in Massachusetts. And I very specifically said to him, we know with absolute certainty, because we have emails saying that a request was made at the Holyoke Soldiers' Home for the National Guard, the Massachusetts National Guard, to come in there and help out because staffing was such an issue. People were calling out, people were scared, et cetera. So I asked General Keefe, what happened to that request from Holyoke to the National Guard? And he looked at me, and I'll never forget this answer. He said, Senator, we never got that request.
Wow.
So what that tells me is that at some point in time between request going up and then the folks who would have implemented that order, they never knew that the request was out there. And of course, then decisions were made to merge wards together. And then of course, the National Guard ended up coming in the weekend, the Monday after. But a request was put in the Friday before. We fixed that. And one of the main things that we did is that we said, okay, for any number of reasons, and I would make an argument here that veterans in Massachusetts should have a cabinet level position anyway, irrespective of anything that happened at the Holyoke Soldiers' Home. So it's a good thing. But what we did is we took DVS, the Department of Veteran Services, out of the chain of command of the Executive Office of Health and Human Services and made it a cabinet level position. And so in theory, what happens right now, and I think what we're seeing with the new secretary, Secretary Santiago, is that when an issue arises, you know, whether it be Chelsea, Holyoke, or any of the other abundance of veterans issues that are out there, it's going to be just one. It's going to be a straight line from the secretary, who was a commissioner, now is a secretary, to the governor saying, you know, Houston, we have a problem and we need to do something about this ASAP. And that means a lot. The other thing I would say, though, is one of the concerns that I had as we were having this dialogue and back and forth about removing it was, I said, okay, one of the problems that I anticipate here is that if you take DVS, Veteran Services, outside of the Executive Office of Health and Human Services, in some respects, you're removing the public health folks, the medical folks who are the most equipped to make this decision. So what we also did is we really empowered DPH, the Department of Public Health, to have a very present role at both homes and really had to really put some standards in there that said not only are you going to go into these homes, but you're going to hold them accountable in terms of this is what we found when we went in there, and hopefully they find nothing, but this is what we found, and oh, by the way, you only have a short amount of time to fix that. And oh, by the way, if there's a challenge with you fixing that, you're to let certain people know, some of them being the legislature, so we can allocate funds. And I'll just finish up with this. One of the things that I think the Senate President, Karen Spilka, did that made a lot of sense as we were taking up this legislation is she said, we know that there's likely going to be unanticipated consequences. Or more even specifically put, we know that there's going to be challenges that, you know, we don't anticipate right now. So here's what we're going to do. We're going to create a working group, and Senator Velis, you're going to be the chair of it, that's really going to be responsible for maintaining close relationships with the new secretary, but also both homes, and asking them, is there challenges? Is there things that we can be of assistance? And there was a great there's great evidence of that already playing out rather, where we're being kept abreast of some of the really big challenges that are out there. And not just challenges, but some of the really good things. And I have to tell you, I was at the Chelsea Soldiers Home not long ago, and one of the things that came up, which I thought was really satisfying, if you will, was that Holyoke really right now, and anything can happen tomorrow, but right now is really being viewed as a model in terms of how they're doing things. So we are in a good place right now, but to say that we can't rest on our laurels, to say that we need to continue to be resolute would be an understatement. And again, it's not just, we saw tragedies like this pan out all over the country. And there's a lot of lessons learned in this process. And to me, what distinguishes a good lawmaking body from a bad lawmaking body is how nimble you can be in your response. Because the legislative process, and I don't think I'm going to surprise you or any of your viewers, is not the most efficient in terms of expediency in dealing with a challenge. I think we were really fast in being on this. And I think that's a good thing. And I think it's a good thing, but again, you can't rest on your laurels because there's any number of instances. And I guess I would point to maybe like the DCF space, the Department of Children and Families, where you do something, you mitigate a threat that's out there, you rest on your laurels, and then a year, 2 years down the road, you hear about some horrific, tragic incident that makes folks say, how do we miss this? How do we miss that? So I think we're in a good place for today.
Excellent. You're the chair of the Mental Health Committee in the Senate.
Yeah.
That's a huge topic.
Huge.
A huge issue. One thing that I've been told is that there are workforce issues, trying to get people to do the jobs that are needed within the field of mental health. Is this something that you've heard? Is this true?
Yes.
And if it is there something that the state can do to try to encourage people to go into this field?
To me, it is the number one question right now. It is the workforce challenges that, quite frankly, we're seeing in many industries. But what we're seeing in the behavioral health space, and I think it's important to remember, right? So the committee is actually the Mental Health, Substance Use, and Recovery Committee.
Okay.
And there's a lot of co-occurring conditions, right? In many instances, individuals have both things going on for any number of reasons. But I'll tell you a story. About a month and a half ago, I was at Westfield State. I've been doing this listening session where I'm going into schools at all levels, and I have called them, let's talk about mental health. So I go in, and I'm aspiring PAs, aspiring RNs, social workers, so all of the people that potentially could make up this workforce. And in fact, my legislative aide, who's here with me today, was with me when I did this. And I asked the question, I posed the question, there's about 150 of them there. And I said, who in this group, all folks that are going to be in the frontline healthcare workers, are contemplating going into behavioral health? Not a single hand went up.
Wow.
Not a single hand went up. And I said, okay, so let me ask you this. If the state were to incentivize, if we were to say we will provide scholarships, if the state were to say we will give loan reimbursements, all those things, raise your hand if you would then go into it. Every hand went up. So one of the challenges in this industry is that, we have the great resignation. Many people have resigned. Many people have, COVID really kind of expedited a lot of people's retirement. But also, folks just aren't going into behavioral health. And I think a lot of it has to do with, unless this is something you really want to go into, our medical schools, our RN schools, in my opinion, and they may push back, and I think we're having this conversation, I'm not sure we're doing enough to expose folks to those fields. Additionally, there's this statute in Massachusetts known as 257 that deals with the reimbursements. Now, mental health parity is a very long, difficult, complex, and nuanced subject, but the reality is, and I would debate this point with anybody, that what providers are being reimbursed in the mass health space for both substance use disorders and mental health concerns, it makes it so to do that line of work, if you're not a mission-driven organization like, say, a BHN around here, or taking the overwhelming majority of your clientele, if you will, is private insurance, you're going to lose money. You're not going to be able to do it. And we've just seen this, for example, detox beds at Maravesta closing down. We need to change 257. Now, the statewide health commission, we are told, is that we know that they're actively engaged in that. They need to increase those rates for the reimbursements, but we also need to create that pipeline. We need to reach out to, quite frankly, kids, younger and younger, and say, this is a field. And oh, by the way, if you go into this field, we'll pay for your school. So that conversation at Westfield State just so happened to be at a time when we had this leftover ARPA money, $200 million, and we created this statewide commission, the Behavioral Trust Fund. And the week after that, this is why I knew we were on the right path, is we allocated $200 million for just that, for loan reimbursements, for scholarships, for people to go into these fields. And it's easy to see the problem that this happens. There's probably going to be a lot of viewers who watch this and say, you know, my loved one, we'll just say my son or daughter, whoever, expressed and said, which, oh, by the way, to me is the hardest 3 words to say and the most courageous 3 words to say, which is, I need help. And they're picking up the phone and they're calling their doctors and they're saying, hey, my son or daughter needs to talk to someone. Things are going on. And they're being told, yeah, 6-month wait.
Wow.
Well, what's that going to do? And we also see that in the substance use space. We've lost a lot of people in Massachusetts to drug overdoses who said they're willing to get help. But the response they got is, you can have this bed in however long. You can get this mental health, behavioral health treatment, 3 months from right now. That's just the wrong answer. Workforce shortages are a really big driver of this, because you can have all the beds in the world, but if you don't have enough providers, and then you don't have enough beds if someone needs inpatient response. That's why I go absolutely berserk when I hear this conversation in the media about, we're going to be opening up these beds, we're going to be doing this. If you don't follow it with saying, we're going to be opening up these beds, but we also have the staff to staff those beds, don't talk to me about beds, because they don't exist. So the short answer is, I know that was a very long answer, was
no, it was a good answer.
We just allocated $200 million, but the Senate president, who really entrusted me to chair this committee, said, John, that's just going to be, we are going to continue to visit this and revisit this, because $200 million, and this is my opinion, for the challenges that exist system-wide and statewide in this Commonwealth, barely scratches the surface.
So, during the pandemic, all of our public health focus was on COVID, and this was understandable. And I keep reading that during that time, though, that opioid addiction has been climbing back up.
Absolutely.
And a lot of it had to do with the nature of what the pandemic was like, people not working, people not interacting, people not even seeing people, you're on your own. Is this something that your committee is also looking at in terms of what do we need to try to reverse this in terms of additional services?
Absolutely.
You're talking about treatment beds. Do we have an adequate number of beds? Clearly we don't have the adequate number of people that you just talked about. But is this? I think some people actually thought, well, don't worry, it's on the decline, and they're not paying attention that it's not on the decline.
So if you look at the history of the opiate crisis, and I want to be very clear here right now, opiates are one driver of this, and I guess I'll revisit this in a second, but it started off, and we've all seen the books, the movies about the role that Big Pharma played in this, Purdue Pharma specifically, but also others. Folks getting hooked on prescription pain pills. That was kind of the first stage of the opiate crisis. Then it became a heroin crisis. And kind of this third phase that we find ourselves in right now, that we just had a big hearing on Monday of this week at the State House, was the contamination of the drug supply. So what's happening right now is that the main driver of accidental overdoses in America right now is this substance known as fentanyl. And you just, and I hope someone is listening right now that, that this might have an impact on. You cannot do any substance today at all, whether it's illicit or a big problem we're having with kids is social media buying pills that they think that are being advertised as a certain substance, but in fact they have fentanyl in them. So unless you get a pill at a CVS or a Walgreens, assume it's got fentanyl in it. The contamination and the adulteration of the drug supply is making it more and more deadly, 100 times stronger than heroin, than morphine, and people are overdosing left and right. That's the main driver of this. And in the answer to that question, there's a philosophy in the recovery world known as harm reduction, which is really just minimizing risk, right? It's a perfect example of this is checking a drug supply, right? So what this looks like in reality is someone who was going to use, not ready for treatment, not ready to kind of turn over a new leaf, if you will, can actually go and test a drug supply, right? And 99.9% of the time, it's going to have fentanyl in it. And what that happens in those instances, that person has a decision to make. And a lot of times they do. We've got empirical data showing that they do. They might not use because they don't want to die, but also they might minimize how much that they use and kind of just alter their behavior. That's how deadly this fentanyl stuff is out there right now. It is quite literally killing people left and right. So harm reduction because of the presence of fentanyl in the drug supply. And this is a whole nother, there's this substance, xylazine, and this is it's an animal sedative that's showing up more and more. It really started to rear its head in the Kensington section of Philadelphia. And what's happening with that is it's prolonging the effect of fentanyl, but it's also causing folks to pass out for much longer time periods. So we're seeing a huge uptick in sexual assaults when people are passed out, and a huge upticks in people being robbed, but also a huge upticks in necrosis, amputations. It's just a very unsafe product, and we're seeing that more in Massachusetts. So the contamination of the drug supply is really the main driver of what we're seeing right now. And then the last thing I'll say is this. You know, typically fentanyl for the longest time was found in the opiate supply, right? It is an opiate. What we're seeing now is a lot of people that are losing their lives are what we would consider, you know, a recreational user versus someone who we'll say is in the throes of an addiction. You know, we're seeing fentanyl in cocaine. We're seeing it in methamphetamine. There has been evidence that it's been in marijuana. And it's, again, kind of going back to harm reduction. And if you are doing a substance out there, I would argue there needs to be an assumption that fentanyl is going to be in this.
So part of your committee deals with addiction, obviously. I understand that there has been a movement, I believe, in the Senate to bring back happy hours in Massachusetts. Now, I'm a lot older than you, and I do remember happy hours, and it's like you order a beer, but there's 2 beers now. It was absolutely a guaranteed way to get drunk at a bar, absolutely. And it's been done away with for a number of reasons. Do you see any reason why we should bring something like that back, especially considering the addiction side of it and the public safety side of it about people driving drunk?
Yes, and I went to undergrad at University of South Florida, so I can vividly recall the 2-for-1 beers and come get free appetizers, that
Yep.
type of stuff. They get you in the door to spend money. I certainly understand the business side of it, but Michael, your question really even raises what I think is one of the most forgotten conversations in the addiction fight right now. You can talk all you want about fentanyl, opiates, and everything else. The number one driver of causing pain and misery, I think in the world today, is AUD, alcohol use disorder. So I share your concerns about the public health impact. I share your concerns about the public safety impact. I'm not in favor of it. I think I think there are ways you can help small businesses and restaurants and places that serve alcohol separate and distinct from bringing back happy hour. That's what I would say. So I'm not cheerleading this. I think that it's an uphill battle for many of the reasons you referenced in your question. And again, because there are alternatives, right? We know our restaurant industries, many of them, were decimated by COVID.
Right.
So we have to be mindful of that. That's a very legit and genuine concern, and we need to do what we can to help them stay open. Obviously, to drive small business is the backbone of our economy. I would suggest that there's ways to do that other than happy hour.
My other concern is just what, if it ever came about, the liability insurance, the cost that would be, with the cost of paying your liability insurance if you're a bar or restaurant offering happy hour, actually balance out with whatever additional boost in business. It would seem to me that it would be an uphill battle for that.
A very, very legit question.
So we got a couple minutes left, and my boss Steve here always likes me to end out, especially with someone that we've not talked to before, with the question, why are you doing this? Why did you get involved being a public servant in government? We always like to hear the origin story, so to speak. What led you to the decision that you wanted to do this?
2014, sitting on a beach in Cape Cod. I'd gotten back from Afghanistan 2 days before that. My first deployment in Afghanistan, I was doing a lot of rule of law, going out into, I was going to say the communities, going out to villages and doing these things called KLEs, key leader engagements. And I had this epiphany, if you will. I was sitting down, and this happened on multiple occasions in this deployment, sitting down with fellow soldiers, Afghans, and meeting with various legal partners, attorney generals, police. And I had, an epiphany that this place in Afghanistan, that at the time, and arguably still is, the most violent place on earth, we were bringing together people that, let's say we were there on a Tuesday. On a Monday, they would kill each other. On a Wednesday, they would kill each other. But we were able to implore them in many respects and impart to them the value of compromise, the value of putting down their weapons, the value of working together. And so now fast forward to being back in America. Well, at some point in Afghanistan, I had this mindset that I was having a conversation with them through my translator, and I was thinking to myself, all of this stuff that I'm encouraging them, compromise, all that stuff that I'm really weighing in on them to try to embrace, I don't know if that would work back in my own country. So I come back to America, on the beach in Cape Cod, I read that, former Senator Mike Knapik's taking a job at Westfield State, former Rep Don Humison running for Senate, and I said, I can be that guy on the beach in Cape Cod who is condemn, the world as I see it and talk about how bad the process is, or I can run and try to be a little bit different. So my motivating factor was I see what's happening in our country. I see the political divisiveness and discord back then that I still see today. And I said, I'm going to run, and I was fortunate enough to win. And my approach was always going to be like, chill out, if you will, with some of this political party divisiveness and kind of just look at issues based on the merit of those issues as opposed to what political party has come up with that idea. And I'd like to think, however many years later, I've honored that.
Excellent. Senator, thank you so much for taking the time to come and talk. And folks, I hope you stay tuned for other programming here on Focus Springfield, and thank you for joining us for this edition of Government Matters.